Hello everyone, this is Dr. Quinn Sue here. In today's video, we will be talking about the treatment options for an edentulous site. Tooth loss is a prevalent occurrence and can negatively impact a person's quality of life, whether it's aesthetic, speech, or daily function. After a tooth is lost, there are 4 options that one can take. The first option is no treatment. The edentulous site can be left alone. Over time, the alveolar bone will shrink, the adjacent teeth can tilt into the edentulous space, or the opposing tooth can supra-erupt into that space. These changes can negatively impact the occlusion and contribute to food trap. However, if a patient is interested in restoring the edentulous site, the first treatment option would be a removable partial denture. The advantage to a partial denture is that it can be fabricated in a relatively short period of time. It does not require significant alterations to the dentition, nor does it require a surgical intervention. The added benefit is that it also is the most economical restorative option. The disadvantage to having a partial denture is that it is removable. Sometimes it is not comfortable to function with the added hardware in the mouth. It may also rock as one functions on it. The longevity of a denture varies depending whether it is metal reinforced, and it largely depends on the patient's use and daily care. The second restorative option for an edentulous site is a dental bridge. A dental bridge is something that is fixed in place. The adjacent teeth to the edentulous site are shaved down to form a smaller version of those teeth. An impression is taken and is sent to the lab for a fabrication of that bridge. 2 to 3 weeks later, the bridge is fitted and permanently cemented into the mouth. A bridge can yield a high aesthetic outcome and does not require a surgical intervention. The length of time from the beginning to the end is also relatively short. The drawback is that the 2 supporting teeth need to be shaved down, therefore decreasing its natural structure. Further, the 2 supporting teeth need to be in good health in order to support more load. In some situations, root canal therapy is also required before the bridge is cemented. If a tooth fails, the whole bridge is lost. Because the unit is fused together, daily brushing and flossing requires a little bit more of an involved technique compared to caring for individual teeth. The long-term survival of the bridge will vary with each patient as each oral environment differs. So depending on the study, the average survival rate over 10 years for a bridge is about 84%. The third restorative option for an edentulous space is a dental implant. Dental implants are titanium fixtures that replace the root of the tooth. It comes in 2 components, the implant itself and the white crown that is inserted over top of the implant. The implant is surgically placed into the jawbone and, like a bridge, permanently stays in the mouth. Dental implants are mechanically and biologically held in the jawbone. It does not have any mobility when in health. It does not rely on the adjacent teeth for support and is an independent entity. The dental implant process begins with ensuring that there is adequate jawbone to support the implant. If there is insufficient bone, the bone is built up prior to implant placement. Next, the implant is placed under local anesthetic. Many patients are actually quite surprised at the comfort of healing from implant surgeries. Typically, a period between 3 to 6 months is allowed for the implant to integrate. When the implant is strong enough, a lab-fabricated white crown is secured to the implant via a screw or cementation. one can immediately function on this implant. This option does take the longest to complete, and some patients will require a transitional appliance during healing. The cost of a dental implant is usually higher than a bridge. The longevity of an implant varies depending on which study you read, but typically over a 10-year period, there is a 95 to 98% success rate for healthy individuals. When communicating treatment options, it may be useful to have a visual aid. You can put together something as simple as this document to demonstrate the difference between the various treatment options. Here we have a removable denture, a bridge, and a dental implant. Alternatively, you can find models that will demonstrate the same concepts. I hope the content of this video is useful for your practice, not only for yourself, but also to assist in educating your patients. I'm Dr. Quinn Sue. Thank you for joining me. See you next time.